What is LMU EMS? Well, Loyola Marymount University Emergency Medical Services is an on-campus volunteer organization composed of students just like you. We, the members of LMU EMS, come from various grade levels and academic disciplines, but we are all nationally certified EMT basics. Many of us are also involved with service organizations and Greek life, among other campus groups. We work alongside other healthcare professionals such as the Student Health Center and the Los Angeles Fire Department. We also interact with various university organizations such as student housing and public safety. The goal of our program is to provide quality emergency medical care to anyone on campus whenever the health center is closed. We understand that medical emergencies can happen at any time, so we are here for you every night during the week, no matter what you may be calling us for. What types of calls do we respond to? Well, there are 4: trauma, orthopedic, medical, and ETOH. During a trauma-related incident, we evaluate and treat all aspects of bodily injury. While bruises, cuts, and scrapes tend to be the norm, we also deal with burns, concussions, and any other physical harms that may have happened to your body. Another type of call we receive is orthopedics, or incidents related to your muscles and bones. For example, strained ankles, twisted wrists, and dislocated shoulders. Medical calls are a little trickier. This is the most broad category, where we evaluate anything from a fever to a heart attack. Our personnel is trained to respond to a wide array of ailments affecting your body. Last, we have our alcohol-related calls, or ETOH calls. These patients, more often than not, have consumed a potentially dangerous amount of alcohol and require medical attention. We do our best to help these individuals get better, which sometimes can include a trip to the hospital. With that said, we want the student body to know that the university has granted a new policy concerning alcohol to take effect in the 2010-2011 academic year. The Good Samaritan and self-reporting policy is designed to remove barriers for students who need to seek medical attention for impaired friends in alcohol or drug-related emergencies. But what does that mean? Let's look at an example. Let's take Bob and Andy, 2 friends and roommates who are under the legal age to consume alcohol. In a friend's dorm room, Bob is having way too much to drink, while Andy has a moderate amount to drink. On the way back to their room, Bob loses control and passes out on the floor. Andy is concerned for his buddy Bob. He decides to call public safety so that he can have the campus EMTs sent to help, but hesitates whether he should stay until help arrives or go to hide out in his room. Fortunately, Andy doesn't have to think about this choice anymore because of the Good Samaritan and self-reporting policy. Even though Andy is underage and consumed alcohol, he stayed with his friend until he knew that Bob would be cared for, so he is protected from punishment under the new policy. Bob, on the other hand, is endangering his health, so he will likely have to go through a judicial process. As you know, alcohol can be extremely dangerous. Many medical problems can occur when alcohol is consumed in excess. Serious cases can include alcohol poisoning, aspiration pneumonia, or even death. We want students to make responsible decisions concerning alcohol, and in the event that a friend or another individual is intoxicated and needs medical intervention, we truly hope that they will do the right thing by calling for help and staying with the person. If you have any questions about the university's policy concerning alcohol or about this new policy, feel free to ask a member of LMU EMS or a Student Health Center employee. And don't forget to consult your student handbook.